from the family's perspective, any tips you have for them in terms of what to look for, how treatment works best?
My name is Nancy Marchese. I'm a board-certified doctoral level behavior analyst and a clinical psychologist. My goal is to help 2 million children with autism and their families by transforming their lives, and I can't wait to help you too.
When they're trying to figure out, what should I do for my child? Or, there might be somebody in like rural Ontario right now looking for something that's a best fit for their child. What do you think is important for them to look for?
What is feasible for them? So not every family has time and resources. So coming up with a plan, what's feasible for them. I know you spoke about rural Ontario, and I remember training a family for toilet training for the kid, and that worked. But just starting gradually, because even a little bit will make a lot of difference. So just starting, and then we can build upon those skills.
That's really good advice for families who might even be feeling a little overwhelmed. There's so many acronyms. You Google search like autism therapy or how to help my child with, I don't even know what comes up. I try not to look at it because it's like, for me, it's overwhelming as a professional to try to sift through all that. So getting started, something that's evidence-based that is likely to be effective. And being kind to yourself too. It's okay to take it in steps, right? And we've had kids too that we've worked with who maybe because of the landscape that we're in right now, they can't get the most amount of treatment that's the ideal for that child. Not every child needs comprehensive or intensive behavioral services, 20 or more hours. Some do, but not all of them. And some, they might need that, but they can't afford it. Funding is not in place for their family. And so they do what they can, right? And we've had kids like that, and that will start with anything. Any experiences that you have to share where like, hey, the child starts with what they can, family starts, and kids can grow that way too. Any experiences that you've had like that?
Lots. But one of the things that I actually learned from you, Nancy, is even just a little bit will just stretch it. Like all the funding you have, just stretch it so you can use it for a longer period of time, but you're still accessing services, whether it's once every week rather than 4 times a week. Even that makes a difference. So accessing services is important, and even just a little amount makes a difference. Yeah.
There's only so much we could cover in the short amount of time we had today. If you found value in what we talked about, go to breakthroughautism.ca, join our newsletter, and also follow me on my socials.